Hello everyone. Today I'm going to talk about face masks and COVID-19 in the context of Australia. The policies around wearing face masks have been changing a lot in the recent days here in Australia, and there are lots of confusions, queries around this. So I thought that I would come up with this presentation and hopefully you'll get answers to many of your questions once you go through this. I'm Dr. Kazi Mizanur Rahman. I'm a medical graduate and epidemiologist. I have been working for public health for the last 20 years. I work in research in the academia and also in the program. Now, the one question that have been asked a lot these days is that we had surge of coronavirus cases in the past around around the end of March, early April. But at that time we were saying that only those who are having symptoms, they should wear masks if they go in public. Those who are not having symptoms, they do not need to wear masks when they go to the public. But if you are caring for someone who is having symptoms or who is having coronavirus, you might need to wear masks. But now, when we are having a similar surge of coronavirus cases, like we are now having around 500 new cases every day, as compared to then in late March, early April. Now we are saying that especially in those areas where we are having lots of cases, if people go to the public, they should wear masks, everyone. So why we are changing our policies, our advisories now? Now if we look at then, which was around the end of March, early April, you'll see that more than 60% of the cases acquired their infections from overseas. Whereas if you look at now, this is as of 3 p.m. 22nd of July, you'll see that around 40% of the infections are actually acquired overseas now, which has come down a lot, and it is even much less in Victoria. And what is most worrying is that lots of cases are under investigation in terms of their source of infection. So if you compare between then and now, you'll see that in the past most of the cases were overseas acquired. Now many of the cases are happening locally, and many of those cases, we do not even know from where they got the infection. So they are not from known clusters, which is the most concerning thing. And that's why the policies are changing around wearing face masks. And also there are recent evidence about the aerosol transmission of the virus, so which has also changed the policy around wearing face masks globally. So Australian government has changed their advisories, and they have left it on the states and territories in terms of decisions regarding wearing masks. And in Victoria, they have made it mandatory. In Melbourne metropolitan area and the Mitchell Shire from 11:59 p.m. on the 22nd of July. And this is an interesting photo that was taken from the abc.net.au website yesterday, and it is in Melbourne, and someone is providing a free mask if someone buys a coffee, which is nice. Now the question is, how do face masks protect coronavirus infection? We all know that Coronavirus transmits through droplets when we sneeze, when we cough, and the droplets, they land on surfaces, and if someone touches the surfaces and then touches their face or mouth, that person can be infected by the virus. And also if someone is in contact with someone, if someone hugs someone or kisses someone, the virus can also be transmitted. So this is usually a droplet and contact transmission. But for few droplets, they go through the process of atomization, and they become smaller, they break down, they evaporate, and then they can actually float in the air. They become aerosols. And this is the problematic part. And these aerosols, when inhaled by a healthy person, that person can be infected with the coronavirus. And this is where we need to think about the usefulness of wearing masks. So the person who is sneezing or coughing, if that person wear a face mask, the droplets and the aerosols will not be able to go farther. Many of them will be blocked by the masks. On the other hand, the healthy person, if that person is also wearing a face mask, then that person will be protected from those droplets, from those aerosols to some extent. So the ideal is healthy persons and the ill individuals, if they both wear masks, that would be great. And this study has been taken from a recent paper published in the Proceedings of the National Academy of Sciences in the United States of America. And here they have shown that in New York City, when they introduced face covering, they could control the outbreak in a much better way than the rest of the US, where they were just using social distancing, staying at home, but not face covering. And this is from April to May, and this study has shown that around 66,000 cases have been saved by just introducing face covering alone in the New York City, and similar findings have been found in Italy. So it is said that face masks in conjunction with other protective measures like physical distancing, hand hygiene, all those together work very well. Now the question is, which face mask should I wear? This is a very good article published in The Conversation recently, and very recently actually, and it is written by Dr. Abrar Ahmad Chuktai from the University of New South Wales. And I have taken some extracts from this article for the next few slides of mine. So the question is, which face mask should I wear? Surgical masks, yes, we can wear them. Cloth masks, yes, we can wear them. N95 masks, according to CDC, they should not be worn by public. They should be kept for healthcare workers and other medical personnel. And in terms of price, they are quite expensive. They may be quite good, but they are quite expensive, and it may not be feasible, financially viable to purchase N95 masks and wear in the community on a regular basis. And we do not want a shortage of N95 masks that should be used by the medical workers who are dealing with the patients face to face, and who are doing different procedures that can create aerosols. So surgical masks, it can be blue or green in color, can be purchased online or from the pharmacy, and they are better filters of particles from coughs and sneezes, and less likely to get infected if someone wears that. And I went to the pharmacy a few days ago, and I have seen a lot of surgical masks, but also I have seen N95 masks, and people were a bit confused. And definitely the prices of the N95 mask was quite high as compared to the surgical masks. The things that you should do when wearing the surgical mask or the medical mask, and this is taken from the WHO website. In the description of my video you'll find the links to the link to a WHO website where they have provided nice videos around wearing masks. So before wearing a medical mask or a surgical mask, the first thing that we should do is we need to wash our hands, inspect the mask for tears or holes, find the top side, and then ensure that the colored side faces outwards, and place the mask properly on your face, covering your mouth, nose, and chin, and adjust the mask on your face without leaving any gaps on the sides. Avoid touching the mask, it is very important. Remove the mask from behind the ears or head, and keep the mask away from you and surfaces while removing it. And discard the mask immediately after use, preferably into a clothes bin. And then wash your hands after discarding the mask. So these are all one-time masks. The things that you shouldn't do while wearing a medical mask is do not use a ripped or damp mask. Do not wear the mask only over mouth or nose. Do not wear a loose mask. Do not touch the front of the mask. And do not remove the mask to talk to someone or do other things that would require touching the mask. And do not leave your used mask within the reach of others, and do not reuse the mask. Now, if you cannot find a surgical mask, use a cloth mask. You can buy it ready-made from the shop, or you can make one by yourself. They may not be as good as surgical masks at filtering out particles from coughs and sneezes. And you need to look at several things when choosing or making a cloth mask. Firstly, try to make it 2 or 3 layers of fabric, and use fabric with a high thread count, and fabrics made with more than one type of thread, for example cotton and silk would be good. And the good thing is that these masks can be reused, so it can be more financially affordable, viable, or sustainable. Wash them with soap and water or household detergents, or preferably in a washing machine at 60 degrees centigrade. Put the mask somewhere isolated until you can wash it. And the things that you should do, they are similar to the medical masks that we just discussed, like clean your hands before touching the mask, inspect the mask for damage or any dirt, and adjust the mask to your face without leaving gaps on the sides. Cover your mouth, nose, and chin. Avoid touching the mask. Clean your hands before removing the mask. So this is something new. When we were talking about the non-medical or surgical mask, we didn't ask for washing hands before removing it because we are going to uh, dispose it. But it is actually always good washing your hands or sanitizing your hands before removing the mask. Remove the mask by the straps behind the ears or head. Pull the mask away from your face. Store the mask in a clean plastic resealable bag if it is not dirty or wet and you plan to reuse it. Remove the mask. So this is important. So you can carry a resealable bag with you if you are going to, for example, a workplace for the whole day. Remove the mask by the straps when taking it out of the bag. Wash the mask in soap or detergent, preferably with hot water, at least once a day. So you need to wash your mask every day if you're using a cloth mask. Clear your hands after removing the mask. That is the last thing that you should always do. You shouldn't do not use a mask that looks damaged. Do not wear a loose mask. Do not wear the mask under the nose. Do not remove the mask where there are people within 1 meter. Do not use a mask that is difficult to breathe through. Do not wear dirty or wet masks. And do not share your mask with someone else. You shouldn't do that. This photo is taken from the CDC website, and we can see two persons, and they're wearing cloth masks. It's good that both are wearing the masks. And they are also physically distancing. And by doing all this, we will be able to control the spread of COVID-19 in our community. Thank you for your patient hearing.